All right, some extra therapies include hydrotherapy, and hydro refers to water. So this would be things like whirlpool, massages. We do make hydro massages, so they make particular water beds that you can lie on where water kind of flows underneath you. And both of these really help to relax your muscles because it's usually warm, and it helps to increase your circulation. You can also do what we call a contrast bath. So essentially you go from hot to cold and hot to cold, and you go back and forth. This is not used in practice an awful lot with the exception of some athletic events. And they do use this for different sorts of purposes, so it's not very common. Underwater exercising, however, is very common. Warm swimming pools helps to relax the muscles, relax the joints. And you actually weigh less underwater, than you do when you are on land. And so for folks who cannot weight bear, or they have difficulty with their joints, or are elderly and have painful movement with their joints, this kind of movement can help take the pressure off of their joints, and it often feels much better to them. Exercise therapy is another thing that you can do, and of course this involves actual exercise. So this involves becoming more flexible, so stretching, mobility, allowing for more movement, especially after an accident or a surgery. You do want to gain mobility. They could gain muscle tone or muscle strength, by doing more exercises. And again, if you've been on crutches, off of a limb with a surgery, this often decreases the muscle strength in that particular limb, so you'd want to regain some of that. And this exercise therapy really is the primary treatment for a lot of sports injuries, disorders, and post-surgeries. And some benefits include better muscle tone and strength. It can help you get better range of motion, which is what the ROM stood for. If you have a nervous system disorder, it can help you to re-coordinate your muscles. We didn't grow up just knowing how to coordinate our muscles. We had to learn how to walk initially. And if you spend a lot of time after an injury not doing that, you may have to relearn some of those skills. And sometimes our goal is to really help our patients resume some normal activities of daily living. So for example, an elderly stroke patient, some of their goals may just be that they can get themselves showered, dressed, and do most of their daily activities all by themselves. So your role as a medical assistant with exercise therapy is usually as an information, so patient education resource. You can certainly support and encourage them to get through these exercises. They can feel awfully tough to some patients. We'll talk about assisted range of motion in a few minutes, and of course our patient instructions at home and patient education. There are a couple of different types of exercises, and your physical therapist that you work with would determine what type is best for your patient, but you should be familiar with the terms. The first is what we call active exercising or active mobility, meaning that the patient does it, essentially, so it is self-directed. The patient is able to do it themselves, they just need some instructions. And this really helps to increase muscle strength and muscle function. The next type is passive, meaning that the patient does not do it themselves and that somebody physically has to move something for them. So for a very seriously injured patient, the physical therapist, as shown in this picture above, is physically moving this patient's knee back and forth. This can do some of the same thing as the active, although if a patient's doing it themselves, they're more likely to see some gains than if they're just doing it passively or someone else is doing it for them. And last but not least, we have what we call aided exercises or aided mobility, meaning that the patient does it, but they may use a device. Meaning that they use a machine of some sort to help them get through the strength training or the range of motion exercises. So there is a machine that's assisting them through their exercises. There are a few other terms you should be aware of, especially when it comes to active exercises. We can use something we call resistance, and resistance really is using weights or using some kind of exercise band. When we just use our body weight, yes, we gain muscle and we gain some range of motion. However, if we add weights to it, we're going to increase our muscle strength even more. Okay, so this may help your patient have better strength gains. Isometric exercises really refer to a patient who is contracting their muscles, but the joint isn't going anywhere. Okay, this is kind of like ballet exercises, yoga, okay, where they hold one pose. They're not actually moving, okay, their joints, they're holding a pose, but if you've ever tried a yoga exercise, you know it can be quite tough. Right, so it does promote some muscle strength. Okay, so if your patient cannot move a joint, okay, they've had some serious damage, surgeries, or other things, they may want to try this isometric style exercise. Range of motion exercises, again, if they have troubles moving a joint, what you're going to want to do is to allow them to move that joint better. And of course, they can do this active or passively. Either they regain some of the range of motion, so they'll keep swinging and bending and moving until they gradually gain more and more range of motion, or passively, where somebody goes through, they'll actively bend the joint until eventually over time, the more we move something, the easier it is to bend. And for this section, the last thing we'll talk about is electrical stimulation. Okay, this looks like 4 little pads that get placed. They look like EKG pads, so they're very sticky and get placed directly to the skin. And it delivers a very low amount of electric shock. And what this does is stimulates the muscles, okay, and it helps to prevent atrophy. Atrophy is really where the muscles start to waste away, and if a patient can't get out of bed, can't move, is on crutches, okay, the muscles start to become extremely weak. All right, so in order to prevent this, you may stick the electrical stim on the body. Okay, it also helps to promote healing, increase blood flow, and it actually decreases pain. At low levels, okay, this electrical stimulation actually stimulates the nerves too much, which shuts down the pain signal to the brain. So there are people that can wear this for hours at a time. It comes with a very small pack you can put right into your belt, and the patient can adjust the level of the electricity. Okay, and this will decrease pain and muscle spasm in patients that have a lot of back injuries in particular.